Hi, this is Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagar, Bangalore. Gynecomastia is also called as male chest enlargement or man boobs. It is a very embarrassing situation in young males. What causes gynecomastia? Usually, without any reason, this gynecomastia happens in the majority, maybe in around 95% and above the cases. But in few cases, or less than 5%, the genetic, hereditary can be one of the cause, and hormonal imbalance. It rarely happens, and we can make out who are having this hormonal imbalance. So they won't have the secondary sexual characters, like they won't be having mustache, beard, body hair, or there is no masculine body. So based on this, if we have any doubt, then we advise some investigations to prove, to know whether they have an hormonal imbalance or not. But this is a rare case. Commonly, this happens without any known reason. And other rare causes like chronic alcoholic, or some drugs who are taking for a long time, like for example for depression or some other reasons. So then this usually appears around 14 to 16 years and continue to grow up to the age of 20 years. But even after that, it can grow at any given time during their lifetime, but can never reduce naturally. So the only one solution is gynecomastia surgery. Even the exercise and the diet cannot help them to have a normal chest contour. It can never reduce naturally. The only way, the solution for it is gynecomastia surgery. People think they can reduce this type of situation or condition with the diet and exercise, but they will be feeling it is just a fat enlargement. It can happen any other part of the body. But this is something different, a situation where there is a hard gland enlargement will be there. So this hard gland enlargement is very resistant for any exercise or diet. And even they will have some resistant fat deposits in the chest around the hard gland. So that is the reason the diet and exercise is just a failure. And the final or the best or the quick solution or the permanent solution is gynecomastia surgery. So the only solution or the permanent solution, quick solution is the gynecomastia surgery. How it is done? So basically this is done under general anesthesia for the comfort of the patient. Otherwise, if we do under local anesthesia, they will have a lot of discomfort while doing the surgery, and we may not do a justify, or we may not be able to complete the surgery to the best level if we go ahead with the local anesthesia. General anesthesia is very safe, no issues, and we usually take around 3 hours to complete the procedure depending upon the severity and grading. Here we do two techniques. One is a liposuction to remove the excess fat deposit. Another is a gland excision to remove the gland excess. So through a tiny hole in the armpit or axilla, we do liposuction to begin with, because it is in the hidden area. So the scar won't be visible in the later time. And even the gland excision is done through an incision in the lower areolar border. So through which we excise or remove the gland as it is. So then after that, we just put the stitches inside only, which are absorbable stitches. So we need not remove any stitches there. So there are no scars are left behind. We are able to achieve from abnormal chest contour to the normal chest contour. So this is considered as a daycare surgery. So morning admission and evening discharge. So they won't have much pain and all. So maybe minimal, which is controlled with the painkillers. The same day evening, so they can have food, and after that from next day they can resume normal activities. So after the procedure, we show them the gland removed, the fat removed, and also through the photographs what we take on table, we show them the contour has been achieved. So which is very like natural looking, no scars. It stays like permanently. Post surgery, they can have normal food from the same day evening. From next day, so they can resume the normal activities. Maybe they will at home for 1 or 2 days, for the reason that we have done some dressing for them, and which we remove on day 3. So after that, we put waterproof plaster, and post that, so they can have normal body bath and they can also go outside. So they need to wear one pressure garment which we give. They need to wear it all the time, 24 hours for initial 1 month. But they can remove after day 4. So this is to control the swelling and some hardening happening there. So they will come back after 10 days for the removal of this waterproof plaster, and after that we advise them to do some massage. It is a self massage, so they can do it themselves, and using some oil, maybe coconut oil or almond oil. So they will do a massage for the entire chest, front and sides. Already we have achieved the contour. So some swelling will be there, some hardness will be there. So the aim of massage is to reduce this swelling and hardness, and some minor things like sensory disturbances. So these things will settle down in maybe 1 or 2 months time. So they need to do this massage for next 2 months. Each day they will spend around 10 minutes before the bath, and apart from this, so they can resume their gym activities after 3 weeks or major physical activities after 3 weeks.